back to Midday Kentucky, everyone. Well, Dr. John Mullins is here, and he's one of the owners over there at Marshall Lifestyle Medicine. Welcome to the show, my friend.
Thank you for having me again.
Look, there's also a lot of conversation that is out there, men's health and what we do about it. And men don't go to the doctors normally, do they? They sort of leave it to the last minute.
They certainly don't go as often as women do, and they certainly need to. There's some little barrier that exists that just kind of either psychologically or their lifestyle, they just choose not to go as often as women do.
And this is one of the great things that they have over there at their clinic there, Katie, is a men's concierge service. And when we talk about that, let's encompass what that entails when it comes to men's health for you. And what is the concierge service that you're offering?
Well, first off, just talk about concierge medicine in general.
Yeah.
Concierge medicine is the opposite of conventional medicine in the sense that rather than make an appointment, go every 6 months to your doctor, the patients that come to see us at Marshall Lifestyle Medicine, either Dr. Foster or myself, they have access to us 24/7, 365. They have our business cards. They can come in as often as they want, as little as they want, and we are open at all times to talk to them about their unique problems that exist. And men really find that nice. It's something that's it's a new concept, and they've really found that that's really good with their lifestyle.
We appreciate that.
Yeah, so talk to us about testosterone replacement.
Well,
I think I know why, but
yeah.
why is it important for men?
Well, first off, let me just tell you that testosterone is present in men and women,
Yeah.
just in different proportions. And men, it's more prevalent when it starts to decline, and this happens as early as in your late 20s. Men start feeling differently than they did when they were younger than that. In the past, again, as I mentioned last week, this was something that we attributed just to, I'm getting older. I'm just maybe working too hard. But testosterone is the masculizing hormone. It is what makes a man feel that oomph. It is without it and with the decline in it, men start feeling differently and they start getting run down, they start accumulating fat. They have a more difficult time at the gym gaining the muscle mass they were. Their sex drive decreases. It's devastating to a male.
And I think that goes back to the confidence. When you have those issues that you were saying that can start to appear because your testosterone level is going down, what is it that you can do in your clinic to help that? Are you doing injections of testosterone, or how does that work?
Yeah, we have several different methods of delivery of testosterone depending on the person's unique lifestyle. There are injections, there's pellets that we insert that only have to be changed every 4 to 6 months, and then some people find it convenient to use a topical cream. But each have their unique demographic that's most important, but each one works effectively, and it really will restore a man's vitality back to where he was when he was in his 20s. And it's something that I find as a male in my 40s, when I started feeling a decline as I was in my 20s, when I turned to that, my life changed completely.
Does the same thing happen for a woman? Is that something that Katie will look forward to?
Do I need testosterone?
Or is that because of the change of life?
No, absolutely.
So
testosterone deficiency in females is probably one of the most commonly undertreated conditions in a female. And it is something that we also specialize at Marshall Lifestyle Medicine. We're talking about men's health today, but we do 50-50 men's and women. I just have to, as a male, we kind of formulated a lot of the programs around Dr. Foster and myself's unique needs. So on Thursday, I think we're going to talk more in detail about women's health, but a woman needs testosterone. A woman needs all the hormones in proper balance, and that's what we specialize in.
All right, great. Well, we hear you say a lot, invest in yourself. What do you mean by that?
Well, I find that men can sometimes make excuses for why they don't spend the money on themselves. They'll go out and buy a big screen TV, they'll buy a second car, they'll go out and have dinner and wine.
Well, there's the testosterone shot for you. They buy the TV.
Absolutely.
That's what I'm thinking.
Well,
big car.
But when you combine those kind of things where you're investing in your overall health, along with those kind of things, I think is when it really pays dividends.
Well, I have to say, when I first met Dr. Mullins, I went over to his clinic and just went in as a client to discuss what we're going to do here, and he went through the whole process, and it is all about making sure that you give his team the right information. He then goes through your history, he draws blood. I think it's quite a great process to go through. We really appreciate, yet again, you coming in.
Oh, absolutely.
And you are our new lifestyle guru, so we appreciate it. If you want to find out more information for Marshall Lifestyle Medicine, you can see all that information up on your screen now, including their website. Head over to the website because it gives you so much information that you need. We appreciate you coming in.
Thank you guys for having me
forward to
again.
seeing
Thank
you.
you. We'll see you on Thursday
Okay,
for women,
thank you.
right?
Sounds great.
Okay.
Thank you, guys.
Coming up after the break, we're back in the kitchen with Alison Davis from Wild Time.
It's just broccoli salad recipe.